Namaskar. I am Dr. Srinivas K G, Director of Oncology Services and Senior Consultant Medical Oncologist at ClearMedi Healthcare and ClearMedi Radiant Hospital, Mysore. Today, I want to talk to you about a very important and burning health issue, lung cancer. It is one of the most common and serious cancers in India and worldwide. The reason I am speaking to you today is because of awareness can save lives. If detected early, lung cancer can be treated very successfully. 15 years back, we were talking about survival of lung cancer 4 to 6 months or 8 months. Today, we talk about lung cancer patients surviving for 6 to 8 years or more, or even talking in terms of cure. So coming to risk factors, the biggest risk factor for lung cancer is smoking. Whether it is cigarette, Beedi, Hookah, or any form of tobacco consumption would be a threat for lung cancer, causing lung cancer rather. Even passive smoking is very harmful. Breathing someone else's smoke is very harmful. Apart from smoking, air pollution, smoke from the chullas or fuels at home, exposure to asbestos and certain chemicals can be very dangerous and they pose an increased risk for developing lung cancer. Let me tell you that lung cancer is not just a smoker's disease. Today, we are seeing more and more cases even among non-smokers. Due to pollution, genetic factors, so many genetic mutations we talk about, they all can cause lung cancer. And so, all of us need to be aware and careful. What are the signs and symptoms of lung cancer? How do we know if something is wrong? Some of the important warning signs for lung cancer is a persistent cough that doesn't go away in weeks, coughing blood or rust-colored sputum, shortness of breath or chest pain, wheezing sound while breathing. Sometimes repeated lung infections or sudden unexplained weight loss, loss of appetite or constant fatigue can also be some of the signs and symptoms of lung cancer. Often people think it's just a normal cough or weakness, but if these symptoms stay for more than 2 to 3 weeks, you should consult a doctor immediately. So a lot of screening importance is available today for lung cancer. At ClearMedi Healthcare Mysore, we do a lot of screening for high-risk population, especially for chronic smokers. We do something called low-dose CT scan in order to, if there is any suspicious of lung cancer, and we'll come to know if there is any nodule in the CT chest. And if we suspect, we investigate them for further screening and further diagnosis whether these patients have lung cancer or not. So to diagnose lung cancer, doctors would advise generally CT scan, bronchoscopy or biopsy and combination of these. In today's time, molecular testing is also done to understand the exact type of lung cancer, what is a molecular subtype, so that this helps in choosing the right treatment, or what we call it as personalized therapy or precision therapy in advanced lung cancer patients. So coming to the treatment options, the good news is the treatment options have advanced a lot thanks to the newer innovations and technology which has helped to come this far. If detected early, generally lung cancer can be treated surgically or through a technique radiation, where we talk about curative options for these early stage lung cancer. In the last few years, new treatment like targeted therapy, immunotherapy have given very good results and patients are living longer. Targeted therapy means we use medicines precisely in a specific way, specially designed for the specific mutations in a patient's cancer. Immunotherapy we talk about in multiple settings, whether it is neoadjuvant, whether it is adjuvant, whether it is metastatic setting, depending on the stage of the disease. These treatments have given hope and longer survival for several thousands of patients in our country. Today, cancer treatment is becoming more and more personalized and what we call it as precision medicine or personalized medicine. Every patient's cancer is studied at a molecular level, and based on that, the doctor would decide the most effective way how to treat these patients. This is a very big step forward, and it means lung cancer is no longer a death sentence. Perhaps patients are living longer and with a better quality of life. So my request to you, all of you, is please do not ignore when someone has persistent cough or breathing difficulty, do not think it's just a normal problem. Timely checkup is very important and it can save one's life. If somebody smoking, take a firm decision to quit today. Every cigarette avoided is a step forward towards health. And for those at high risk, like smokers, people with family history, or those exposed to pollution, they have to do screening, undergo screening for in order to pick them up in an early stage so that a curative treatment option can be provided to these patients. Remember, awareness and early action are our best weapons against lung cancer. Prevention is better than cure. So together we can fight this disease and save many lives. And if you develop, if or anyone who develops all these symptoms which I told you, can come and contact us at ClearMedi Healthcare Mysore and utilize all the facilities available here. At our center, we do low dose CT screening, we do diagnostic tests and multiple screening tests for various other cancers as well. And we conduct a lot of global clinical trials for lung cancer where the most sophisticated treatments are available free of cost through these clinical trials. And we talk about lot of low dose immunotherapies, low cost immunotherapies, generic immunotherapies for various scheme patients in our community, so that lot of patients who are who cannot afford can actually avail these facility for free of cost or for a very less cost. Thank you so much, and I request all the people to not to neglect any of these symptoms which I told you earlier, and to show the doctors immediately for a better health tomorrow. Thank you so much.